Mike Nelson is my name. I'm 78 years old. I'm a retired electrician, and I was doing a job for one of my old customers. My son was with me holding the steps. As we finished the job and loaded up the car, I tripped and hit my chest. And I said to my son, you know, you're going to have to drive because I'm in a lot of pain. So he got back to our house here, and my wife Brenda then rang up for an ambulance. When I got onto the ambulance, they asked me if I wanted to take part in this trial. I asked what it would involve, and they told me ketamine and morphine, and they were trying to test it out. And they couldn't tell me which drug I was going to have. So they injected me with this drug. It was great. There was no pain. Well, I got to the hospital. I was sent to have a head scan because they thought that I'd fell on my head. We talked about, after the scan, about having a chest x-ray. They did that, and then I moved up to another ward. I wasn't in pain. And one of the chief nurses come up and said, well, you can go home if you want to. A young man called Josh come to see me, and we had a long chat about what the events took place previously. He told me that, you know, it was an ongoing, you know, plan of investigation and seeing which one worked and which didn't. You know, when people are hurt, the first thing that occurs to them is get out of the pain. And that's what this particular drug did for me. And I'm grateful for it. I mean, you know, I'm not a young man anymore. So I feel pain much more than perhaps a young person does. But I was happy to get involved in this study. I think it's fantastic. And well done, NHS.